Hello, I'm Dr. Sanjay Iyer. I'm a movement disorders neurologist and also the medical director at Memory and Movement Charlotte. I treat a wide range of movement disorders, with Parkinson's disease being the most common. I've always believed that a multidisciplinary approach provides the best care for patients and their families. I'm very proud of the amazing team we've assembled at MMC. So what is Parkinson's? What are the symptoms and how can it be treated? No two people with Parkinson's disease are alike. We see patients who are young, old, male, female, all backgrounds and ethnicities. We can break down movement disorders overall into two basic categories: moving too much or moving too little. The term Parkinsonism refers to slow and stiff movements, shuffling gait, and tremors. Parkinsonism is a hypokinetic disorder, meaning not enough movement. Other conditions you may have heard of, for example, Huntington's disease, involve extra movements, typically wiggly and jerky movements that look different from Parkinsonism. Conditions like HD are described as hyperkinetic or too much movement. When we say someone looks like they have Parkinsonism, it means their movements are slow, stiff, and shaky. But Parkinsonism is just a term to describe the movement. It's not a diagnosis. Once the symptoms are noticed, we have to search for the cause. Sometimes symptoms are caused by medications or drugs to which a person has been exposed. But the most common cause of Parkinsonism is Parkinson's disease, which involves a very specific change inside the brain. Parkinson's disease affects about 1 million people in the US. 60% are men, 40% are women. We don't know the cause, but the brain cells that produce a chemical called dopamine start to slowly die off in certain parts of the brain. Imagine the Tin Man in The Wizard of Oz. He can't move, he's very stiff and slow, and what gets him moving is the oil can. Dopamine is that oil for humans. We use medications to replace that oil and make a person's movements more fluid, more natural. So how do we diagnose Parkinson's disease? The gold standard has long been a diagnostic test called a DAT scan. It images a very deep part of the brain where those dopamine neurons are located and shows activity in those areas. The DAT scan is about 94% accurate. The downsides are that it takes several hours, it has to be done in a hospital, it's expensive, and you have to get an IV. A simpler test is a skin biopsy. It looks for a specific protein in the cells of the skin. We can do this test in the office in just a few minutes. It's inexpensive, and results are 95 to 99% conclusive for Parkinson's disease, Lewy body dementia, and multisystem atrophy. This is a very simple way to confirm a diagnosis even before symptoms are very apparent and begin early treatment. To identify Parkinson's, we look and listen for some classic motor features. A resting tremor in which the hand or the leg or the jaw starts to shake while that part of the body is at rest, and then it stops with movement. Bradykinesia, or slowness of movement or lack of movement, is a key feature. Rigidity is something we feel, or stiffness that patients feel in their movement. Postural instability or balance issues can also become common. The lack of dopamine in the brain caused by Parkinson's disease also has a profound effect on our emotions and the way we process things. It can cause depression, anxiety, fatigue, slow thinking or processing, sleep issues, and hallucinations. Because of its effect on the nervous system, Parkinson's disease can lead to other non-motor features, including low blood pressure, where the pressure drops when you stand up, making people feel dizzy and maybe even faint. We see sweating abnormalities, skin changes, constipation, sexual dysfunction, unusual sensory feelings like pains or strange vibrations are common. Engaging honestly with your doctor is critical because there are solutions to these problems. You know your body best, so please tell us about any of these symptoms you may be experiencing. There are also atypical forms of Parkinsonism, or Parkinson's plus syndromes. These mimic some of the typical symptoms, but some of the causes are different. Progressive supranuclear palsy, or PSP, these patients don't have much tremors, but they lose their balance and fall a lot very early in the course. Multiple system atrophy is a condition in which people have slowness, stiffness, like Parkinson's, but they also have a lot of other issues like passing out and sexual dysfunction. Corticobasal syndrome causes slowness and stiffness, but the movements are much more jerky, and there may be some involuntary or unconscious movements of an arm or a limb that we call alien limb phenomenon. Dementia with Lewy bodies or Lewy body disease looks like a combination of Alzheimer's and Parkinson's. There are cognitive changes, memory loss, and hallucinations very early on, and then later, maybe a year or two later, you might start to see some of the motor symptoms like the slowness and stiffness. It's very important to clarify that all Parkinson's patients have pink protein deposits called Lewy bodies in a certain part of the brain. This doesn't mean that Parkinson's is Lewy body disease or that it will become Lewy body disease. These are two distinct diagnoses. In Parkinson's disease, the Lewy bodies are confined to a very specific area of the brain, whereas in Lewy body dementia, we find them all over the brain. Normal pressure hydrocephalus happens when too much fluid builds up and puts pressure on certain parts of the brain, affecting gait, causing memory loss, and also incontinence. NPH is curable with surgery. That's a simple overview of the types of symptoms of Parkinson's. It's a lot to take in, I know, but now you have a basic understanding. Remember, knowledge is power. We're going to focus on the management of Parkinson's disease. Currently, there is no cure. The goal is to maintain and improve movement quality through therapy and exercise, and to use medications and other interventions to manage the motor and non-motor symptoms to help improve quality of life. Exercise is the single most important thing people with Parkinson's disease can do. Every doctor will tell us to exercise, but for PD it's almost magical. It's the only thing we know that can help slow progression of disease. Specialized personal trainers and physical therapists can teach people which exercises will target their individual symptoms the best. The more you move, the better. Remember, a body in motion tends to stay in motion. Some people are actually able to reduce their medications just by exercising more. Exercise is not just a recommendation, it's a very powerful part of the treatment. Medications are used to mitigate both motor and non-motor symptoms to help patients live engaged lives. Because the brain is not producing enough dopamine, the chemical that facilitates movement, the mainstay of treatment for the motor symptoms is dopamine replacement. Remember the oil can? The most commonly used medication in PD is levodopa, which crosses into the brain and is converted into dopamine, which helps make movement more fluid, more regular, and can help calm the tremors. There are several different formulations and delivery mechanisms of levodopa, as well as other medications, such as dopamine agonists and MAOB inhibitors, that can be used in various combinations to target particular symptoms. It's all a matter of how much and what kind of oil your specific engine needs. Unfortunately, most non-motor symptoms are the invisible symptoms like depression, anxiety, cognitive issues, blood pressure fluctuations do not respond to dopamine replacement. There are a number of other treatments, including medications, therapy, and changes in lifestyle that can help mitigate the non-motor symptoms. But every patient is different, and the foundation of our care is to individualize treatment for each person. Healthcare providers really need to listen to patients and their families and gather accurate data to help make the best decisions about treatment. It's also vital to weigh the risks and benefits of each medication or therapy in every case. By working together, we have the best chance to achieve each patient's goals and ultimately help give them the best quality of life possible. So how does Parkinson's progress over time? This condition affects each person differently. Which symptoms appear or do not appear, the order that they happen, and the intensity of each of these symptoms vary from person to person. Younger people are more sensitive to medication and have a higher chance of developing dyskinesia, excessive writhing or squirming movements from levodopa. Older patients are more likely to develop confusion and hallucinations and are more likely to develop cognitive decline from Parkinson's. The progression of symptoms can take years for some patients, while others develop symptoms more quickly. The response to treatment also varies. Some people respond well to therapy for years, while others start to notice the medications becoming less effective over time. We need patients and care partners to bring good data about their symptoms and possible side effects, and how they are related, or not, to the timing of their medications. For example, some people develop dyskinesia when their dopamine levels are at the highest, shortly after taking the medication. This is called peak dose dyskinesia, and the treatment is to give lower doses more frequently. Others develop dyskinesia when they're right near the end of their dose, so the treatment is to take the next dose earlier. Because of so much variability, working closely with your team at MMC is an important part of managing the disease. The progression of Parkinson's disease over time varies for everyone. In the earliest phase, the symptoms are mild and do not interfere with everyday life. Tremors, rigidity, and loss of dexterity gradually worsen, though independence can be maintained for a long period of time. Walking and balance can eventually become affected, and the risk of falls increases. The symptoms can eventually become disabling, requiring assistive devices, such as a walker or a wheelchair for some people. The more active you stay, the better you will do. Throughout the progression of the disease, the goal is to maintain quality of life by focusing on what is working and eliminating what is not. You will not die from Parkinson's disease, and we can help you take charge and manage the condition well. At MMC, we believe in patient empowerment to facilitate active treatment like exercise. Parkinson's won't take a day off, so you can't either if you want to stay ahead. Remember, you have Parkinson's. Parkinson's doesn't have you.